Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody. My name is Dr. Randy Shoup, and I am bringing to you something unique, different, and something you have never seen before. We are going to explore every aspect of how you can live a happier, healthier, more beneficial life than you ever dreamed possible. How are we going to do this? We are going to bring you facts. We are going to bring you information, and we are going to bring you truth. You're going to know things nobody else knows. You're going to learn things on this program that nobody else has ever talked to you about. What are we going to talk about? We're going to talk to you about how the world of dentistry can literally change your life. We're going to talk about how medicine can be a really huge ally for how well you make decisions going forward in living your life. We're going to talk about nutrition. We're going to talk about wellness. We're going to talk about all those things that you need to know so that you can make high quality decisions as you go forward in making choices for how you live your life. Here's what we do. At Microscope Dentistry by Shoup, we make life-changing alterations to how you receive dental treatment. Wouldn't it be great if you went to the dentist and they said you don't have to have your teeth ground down and have crowns put on them? You can have your teeth restored without grinding them down to a little nub. Wouldn't it be great if you could take your children to a dental office and the dental office would say, you know, we can put sealer protectors on your children's teeth and almost promise you that they will never get cavities on the top biting surfaces of their teeth as long as they live. Would that make a huge impact into the health of your family? Would that make a huge impact in terms of what you expect to be your financial obligations for fixing your teeth? Of course it would. And that's what we do. We are absolutely dedicated to bringing to you the information that you need so that you can look for a different way of having your health impacted for the rest of your life. That's what we do. That's what we bring to you, and that is our pledge to you. What you're going to see on this program is a variety of experts brought to you right into your living room so that you can look at them, talk to them. You can even ask questions by sending us information on the website so that you will have information nobody else has. We're going to talk about root canals. We're going to talk about, are they healthy? Are they good for you? Do they really work? What is a root canal? We're going to talk about biomimetic dentistry. You've never heard that term before. And biomimetic dentistry is a new form of dentistry that takes your body's tissue and holds it as absolutely sacred. We don't want to grind away or impact any of your natural healthy tissue in terms of restoring your teeth. We're going to talk about wellness and health. We're going to talk to an orthopedic surgeon that says he can rehabilitate your failing joints by using ozone. We're going to talk to an expert that is going to be able to show you specifically what is real and what is fake about CBD oil. There is a massive amount of information out on the internet and in the public domain about the benefits, health and wellness benefits of CBD oil. You and I are going to break all that down and talk about it very, very specifically. You're going to get the science, the information, and the actual truth about CBD oil. We're going to bring to you experts from around the country that talk about oral and systemic health. Did you know that your mouth, the health of your gum tissue, the health of your teeth has a direct causative correlation to the health of your body? Did you know that the plaque that winds up on your teeth that the hygienist removes, did you know that that plaque is the same plaque that winds up in your coronary arteries? Did you know that by making a major impact into the health of your gums, you make a healthy contribution to the wellness of your heart? Nobody ever told you these things. This is what we are going to discuss. This is how we are going to move forward. And we're going to start the program today with a good friend of mine. We're going to start the program today with Dr. Tom Nasser. Dr. Tom Nasser is a root canal specialist. He is an endodontist. Dr. Nasser and I have worked together for years rehabilitating teeth that supposedly were beyond repair. We can rehabilitate teeth, put teeth back together, let you keep teeth in your mouth that other dentists probably would have told you have to be extracted. Tom is an absolute magician in doing root canals. We're going to talk about and dispel all of the myths and all of the wrong information that's out there on the internet about the health and safety of root canals. We're not going to delve into any of the false claims. We're not going to participate in any of the fake news that is surrounding root canal therapy. We're going to show you how they can be high quality choices for you and high quality choices for the health of your teeth. So these are the sorts of things that we're going to do. I do all of the things that you and I are going to talk about out of my office called Microscope Dentistry by Shoup. Microscope Dentistry by Shoup is the evolution of dental practice here in the Midwest. It is how we approach our patients from a holistic point of view. We dentists don't have any techniques, we don't have any material, we don't have any methods that is better, healthier, or longer lasting than your own natural healthy tissue, your own natural healthy teeth. So my job, biomimetic dentist's job, is to do the least amount of work possible on your teeth, yet building your teeth back together. We want you to have the ability to keep all of your natural teeth for your lifetime. Coupled with that, we want to tell you how we can interact with your children to hopefully never need dental treatment as long as they live. We want to show you, we will show you how we can apply protective coatings to the surfaces of your children's teeth that virtually make it impossible for those permanent teeth to ever get a cavity ever. How would it be if you were able to have gone through your entire adolescence, your entire adulthood, and now into maturity with never having needed a filling, never having needed a crown, certainly never having needed a root canal, never having the need for an expensive implant, never having the need to ever wear plastic teeth that you put into your pocket? You could go your entire lifetime with your own natural dentition. We're going to tell you all about how to do that right after this. Well, welcome back, everybody. As I told you, we are going to be joined by the magic of internet by Dr. Tom Nasser. He is a specialist in root canals, and we want to bring to you actual, true, factual information. If you go to the internet and look up root canals, you're going to be flooded with a massive amount of conflicting information. And this is why you tune in and listen to me. You're going to hear the straight scoop. And so, Dr. Nasser, how are you today?
I'm doing great. Thanks, Randy.
It is a pleasure to have you here. Thank you very, very much. You all need to know, Dr. Nasser and I'll probably call him Tom during our broadcast. We've known each other for years. We've worked together for years. And I've chosen Dr. Nasser as my #1 go-to root canal specialist, endodontist, because of the quality of the work he does. I want to show you a picture over my shoulder of what Dr. Nasser looks like when he's in his office. He's in surgical scrubs, and you'll notice that he's looking through a gigantic microscope, a microscope specifically designed to do dental work. Tom, what is the reason you use a microscope? Why is a microscope so important for you and what you do?
Well, Randy, I'm working through a very tiny opening. Um, if I can see it, I can fix it. The human eye is only capable of seeing so much. When I was in dental school, we didn't have any magnification at all. And then when I graduated, I bought the 2.5 times magnification loupes that are on your glasses. And then I upgraded to 3.5 times magnification. The next thing I know, all of my colleagues are using microscopes, and I was hesitant to get one because of the cost. But long story short, I finally broke down. I bought one, and oh my God, what a game changer. I didn't realize what I could not see. It's a lot more fun being able to see what you're doing. And also for ergonomic reasons, I'm able to actually sit up straight and position the microscope and the patient to where everybody's comfortable. And I can zoom in all the way from 2 times magnification up to 30 times magnification. It really changes just the quality, just being able to diagnose and see things, whether it's a crack or an extra canal, um, leakage underneath the crown, just all kinds of things. But it's fun.
So the big thing for me, and I want my viewers to know, is this: that using a microscope to do a root canal is really considered the standard of care in today's world. So if you go to your dentist and your dentist says you need a root canal, and the dentist simply sits there and brings out all the tools to do a root canal and is not using a microscope, that system is below the standard of care. It is really considered to be essential. And so a lot of people go to their general dentist and get root canals done without the kind of sophisticated equipment that you use. And so I'm confident they get an inferior product at the end of the day simply because the dentist doesn't have the ability to see what you're able to see in microscopic spaces.
Yes, you're right. And it now is considered the standard of care in endodontics. It used to not be. As far as general dentists doing root canals, I've been told that about 80% of the root canals in this country, if not the world, are being performed by general dentists, which do a little bit of everything.
Sure.
Where obviously I do a lot of one thing.
Mm-hmm.
But again, they don't have the same equipment. They don't have this, and it's not just being able to see. They don't have the same training. And I mean, I do more root canals in one day than the average dentist probably does in a month.
And there's a
I'm
lot
a
to
firm
be
believer in specialists too. It's not that the general dentist can't do it, but as long as they know their limitations.
Sure, and there's a lot to be said for the fact that you are so practiced and you are so used to it. You've seen all of the variations and aberrations that just comes as part of your daily routine. Where a dentist who doesn't do root canals very often, the first little stumbling block or speed bump or variation on the theme might throw them off and you'll get a lesser product. Let's talk for a little bit about what is there that causes a patient, a tooth, to need a root canal. There are a variety of causative events. And so let's list a couple of 3 events that most people would know about that would cause them to need to have a root canal.
Well, again, there are various reasons. The most common reason is a cavity. A cavity is the same as decay. It's basically bacteria. And whether that's due to a lack of oral hygiene or an old silver amalgam filling that's leaking or a crown that's leaking, you get food, saliva, bacteria, all kinds of junk can get inside that. And slowly but gradually, that cavity gets larger, just like a cancer would grow, and eventually gets closer to the middle part of the tooth, what we refer to as the pulp or the nerve. And that's usually when your body starts developing symptoms, whether that be sensitivity to cold or hot or chewing or just a spontaneous pain. You know, your body has a way of telling you something's not quite right. You're aware, and then it gets to the point where it bothers you enough that it's affecting your life, that motivates them to go into their dentist. And then if it's a root canal problem, they usually refer it to a specialist.
One of
So
the
cracks are another thing too, but cavities, cracks, lack of oral hygiene, sometimes trauma,
Yeah,
fractured tooth.
in there's a variety of different forms of trauma to a tooth, as you and I know. And one of the most common forms of trauma to a tooth is grinding it down and putting a crown or a cap on it. How often do you see patients come to you that have had a crown or a cap put on their tooth and now subsequently need a root canal after the new crown has been put on? I think that's a fairly common occurrence.
That's correct. And the reason that the patient needs the crown is usually because there is a large filling or a crack or both. And it doesn't always mean that you have to have a root canal just because it needs a crown. The crown protects that. It holds the tooth together so that you can chew on it like a normal tooth and not have to worry about it getting any worse. Unfortunately, sometimes just the process of grinding a tooth down, preparing it for a crown, then it becomes sensitive to temperature or biting. Next thing you know, it turns into a root canal problem.
Yeah.
And they end up in my chair.
Yeah, I'm sure the viewers are going to resonate with that scenario, because you go to the dentist says, oh, you need to have a crown or a cap put on the tooth because the tooth has more filling than it can hold. The tooth has something wrong with it. It has a cavity under the filling, and we have to do a crown. The tooth is then ground down severely, and statistically, I don't know which statistics you like the best, but my statistics are between 13 and 20% of those teeth that get ground down for a crown ultimately will have to have a root canal done. And so that's a fairly high percentage on a procedure that's supposed to make the tooth better, but it ultimately makes the tooth weaker.
Yeah, I don't know what the exact percentage is. I don't track it, but it depends. Sometimes it's better if you think that there's a question that it may need a root canal. It's in the patient's best interest. Do the root canal first before the general dentist puts the crown on there.
Mm-hmm.
Otherwise, I mean, I can still do the root canal after the crown is put on, but it's easier for the patient, me, and the dentist do the root canal first and then do the crown. But I trust the best judgment of the referring dentist. It doesn't always mean that they have to. It just depends on how bad and how big the filling is.
Sure. Well, let's clarify for the viewers exactly what happens when you do a root canal. Let's break it down into some fairly simple steps. There's a lot of misconceptions that the roots of the tooth are cut off, that all kinds of weird things happen inside of a tooth. Walk us through pretty much a step 1, step 2, step 3. What happens in order for you to do a root canal from start to finish?
Well, basically, a root canal is simply an alternative to an extraction, assuming that there's enough tooth structure left. The first part is making the proper diagnosis. Sometimes patients can't exactly pinpoint specifically what tooth is causing the pain. It's usually a temperature or biting pressure pain. So my job is to not only diagnose the tooth, then the next thing I do is numb the tooth, anesthetize, get them comfortable so that they don't feel any pain at all. And then we make a little access opening. We drill a little hole through the top of the tooth so that we can visually see the root canals. We have special instruments that we use to remove the nerve. We clean it, we shape it, we sterilize it, and then we fill it with this rubberized material to create a three-dimensional airtight seal. And then we temporize it, and then we refer the patient back to their referring dentist for the proper restoration, which is usually a crown or a permanent filling.
Yeah, one of the things I want the viewers to look at and think about is the process of doing that. If it's done correctly, kind of think to yourself, how small is the inside of a tooth? And that's the area, that's the world that Dr. Nasser is living in. And so if you're in that teeny tiny space, you need really high levels of magnification. You need a microscope in order to visually see down inside the tooth to make sure that the tooth is clean, to make sure that the tooth is free of any sort of infection or debris. And then you can see very clearly that you have refilled the inside. You don't cut the roots off of a tooth. The tooth is still there. The tooth is still functional. The tooth is still alive. If you try to remove the tooth, patients will complain because the tooth is still attached to live, living things. And once the tooth is restored well, it should have the same life expectancy as it did before. It should not mean that all root canal teeth are going to have a shortened life expectancy. You're going to spend the time and the trouble and the money, and then the tooth will simply fail. That shouldn't happen if the root canal is done well and the restoration is done well.
That's right. And a root canal is not a surgical procedure. There is, if you think of a tooth, let's just say a central incisor, you have a root. Inside the root is a little canal. And it's inside that canal, we call it the pulp. It's made up of blood vessels, arteries, vein, nerve tissue. We just call it the nerve. It's a microcirculatory system. It's very tiny. And the only purpose that serves is in the growth and the development of your tooth. Once that pulp gets damaged or injured, inflammation or infection, we can actually remove that soft tissue, clean it, shape it, sterilize it, and fill it. What keeps it healthy is there's a healthy blood supply from the outside of the root, from the bone that nourishes the outer part of the tooth. So a root canal treated tooth can last just as long as another average tooth. Again, as long as the gums are healthy, what we call the periodontal status, and that there's no cracks. So a root canal treated tooth can last just as long as it's a healthy, gum tissue and there's no cracks.
Now, in the couple of minutes we have left together, there is a lot of misconception. There's a lot of bad information on the internet condemning root canals as the bane of all humanity, as the source of all infection in the human body, as a constant source of disease in the human body. And I want you to help me explain to the people that are listening, there isn't any data, there isn't any science, and what the people that say these things are basing their opinion on is some old wrong science that was brought forth over 200 years ago, and it's been shown time and time again not to be true. Tell the people that are viewing that there isn't really a worry that a root canal tooth causes any disease.
There's not. That internet stuff has been going on for years. It's unfortunate. Just like the politics of fake news, the same thing with any medical procedure. In fact, what I always recommend patients do if they want to educate themselves is go to the American Association of Endodontists. Their website is aae.org. They have a wonderful section on patient education, videos. They've even got a section on myths of root canals, and it answers any question that you can possibly think of. And they just really do a wonderful job explaining that. It is a myth. Yeah. Unfortunately, some people believe that. Just like, coffee causes cancer, or iPhones or something, watching TV causes cancer.
Well, Dr. Nasser, I want to thank you sincerely for being here. Tom, you're my good friend. You have been an absolute wonderful source of help for me treating and taking care of my patients. You have been absolutely spectacular, and you are truly my go-to guy because of your skill and because of your knowledge and how you care about the patients. Thank you very, very much. I know that the people that are watching have learned a lot because of our conversation. Thank you very much for being here.
You're welcome. Thank you. Have a great day.
I appreciate it. Thank you, man. I will talk to you soon. Thank you.
Oh, I will say one more thing. if you want to even learn a little bit more, my website has a wealth of information, nasserendo.com. You can show that later. I put a lot of thought into that, just trying to educate the public.
Thank you, Tom. I appreciate it. Very good. Thank you. Well, that's what we have for you today. We certainly hope that you have been enlightened, you have been educated, you have been given information that you will have received nowhere else. If I can ever be of assistance or help to you, feel free to find my website at drshoup.com, drshoup.com. I will be delighted to be of assistance to you. Until we talk again next time, be sure to brush and floss.